Let me guess. You're waking up at 3 a.m. in the morning, drenched in sweat. You're snapping at your partner for chewing too loud, wondering where your brain and libido have run off to. You've skipped your period for 6 months now, then boom, bam, it's back. Back with a vengeance, like an unexpected rain in the desert. If that sounds like you, you might be riding the hormonal roller coaster called perimenopause. So what is perimenopause? Perimenopause is the menopausal transition. It includes a time before menopause when the body undergoes hormonal changes leading up to your final menstrual period. There are wild fluctuations that occur with the hormones during perimenopause. The ovaries start slowing down production of hormones, and we see decreases in estrogen, testosterone, and progesterone, to name a few things. But here's the thing, they don't always go down smoothly. They can fluctuate like crazy. And that's why your symptoms might be so erratic. One analogy that I always use to describe perimenopause is like a roller coaster. Imagine getting in your car and expecting it to be smooth and predictable, like your normal drive. You turn the wheel and it responds. You hit the gas and it goes forward. That's what you expect from your car, right? Now instead, imagine you got into your car and suddenly it starts jerking up and down, around, all over the place, flipping upside down. You'd be terrified, right? And this is not because roller coasters are bad, but just because you didn't sign up for that when you got in the car. And that's what perimenopause can feel like when you're not prepared for it. Hormones that once followed a nice cadence and went up and down with your menstrual cycle, they start to rise and fall unpredictably. And they can go up super high, crazy high, and they go down super low. And that's why your symptoms can be all over the place when you're in perimenopause. This can affect your mood, your cycle, your sleep, your sex drive, even how your body feels in space. Now, if you are at Six Flags, about to get on the colossal roller coaster ride at Six Flags, you'd expect the loops, you'd expect the drops and the whiplash turns. All of that would be expected on a roller coaster. And you might even throw your hands up and enjoy the ride a little bit. It's still wild, but you're ready for that wild. Perimenopause is the same. When you know what's happening, when you know what to expect, it doesn't feel so scary. You can breathe, grab that safety bar, hold on, and ride it out with a little bit more ease, and dare I say, maybe a little bit of fun. So you might be wondering, what is the difference between menopause and perimenopause? Well, menopause is that moment. It's one moment in time where literally one day, and it's that 12-month anniversary of your last menstrual period. So you go 12 months and you don't have a period. That on the 12-month mark is when you are in menopause. Anytime after that is actually post-menopause. So that's why we say menopause is retrospective. So it's not something that we know until a year has passed. So everything before that day is perimenopause, usually within a few years before that day, and everything after it is postmenopause. So if you're over 40 and you haven't had a period in 6 months, you're not in menopause, but likely you're in perimenopause. I get a lot of questions about how long does perimenopause last? Girl, how long do we have to go through this? And the average time for perimenopause is about 4 to 5 years. But I've seen it last anywhere from a few months to over a decade. So it varies from person to person. You might want to check with your mom if she's around and can talk to you about this to kind of get a range of when she went through menopause. It might give you some information about when it might happen for you. The way it can happen can really vary from person to person. If you're having a lot of upswings in the erratic nature of your hormones, you might suffer with high levels of estrogen at some points that can stimulate things like the growth of fibroids, that can cause heavy periods and anemia related to those very heavy periods. We see this a lot of times where suddenly people start having these extremely heavy periods where they're, losing lots of blood transfusions, surgery needed. And all of this may tie back into perimenopause and the high levels of, stimulating estrogen in the body. On the flip side, you might have symptoms that make your periods a lot lighter. You might not have a period. You might skip a period or 2 or 3 or 6 months worth. Your symptoms might just look like that. You might have vaginal dryness that you're experiencing related to the changes with low estrogen in the body. And so we see a variety of different things that can happen during perimenopause. What are the first signs of perimenopause? Again, this can vary from person to person, but common signs include vasomotor symptoms. That's things like hot flashes or night sweats. And night sweats are hot flashes, a form of hot flashes that occur at nighttime. So you might have hot flashes, night sweats. You can see things like sleep problems, mood swings. A lot of people have sleep problems where they're waking up in the middle of the night at 3 a.m. and just bing, out of nowhere are up and can't fall back to sleep. This can lead to fatigue and mood swings in the morning. You can also have a lot of brain fog that goes on, anxiety. We see all of these things. Sometimes it's just like, I don't feel like myself. And that, again, is related to a lot of those hormone shifts that we see. Also, again, to mention those menstrual irregularities, menstrual cycle changes are very common. Emotional changes and brain fog, a lot of mental health issues rear their heads during this time. And so you ever walk into a room and you don't remember why you walked into the room, and you went in there for a good purpose, but you can't remember what it is once you're in there. That is an illustration of brain fog, and it happens a lot during this time. Another really disruptive symptom is pain or discomfort with intercourse and sex. A lot of libido changes that can occur as well associated with those changes in the way things feel, or just from an emotional interest standpoint, you might see a drop in the libido during this time period. If you find that this is a problem for you, you've got changes in libido, you've got vaginal dryness, pain with intercourse, discomfort with intercourse, you definitely want to talk to your doctor about this. There are prescription treatments for this that can make a huge difference. So vaginal estrogen cream is something I'm talking about all the time, just because not enough doctors prescribe it. I prescribe it to my patients all the time. But for most people, you are a candidate for estrogen, vaginal estrogen, which works locally and not systemically. A lot of people are afraid of vaginal estrogen or estrogen in general because of some of the risk factors that are associated with women who have breast cancer or women who have heart disease, who may not be candidates for systemic estrogen that floats through the blood. But vaginal estrogen is a different thing. And for most people, I just want to bring this point home, for most people who are having these very devastating sometimes symptoms of vaginal dryness, there are solutions for this. So please talk to your doctor. If your doctor blows you off, find another doctor, because there are solutions that can really change this and make things a whole lot better. But there are nearly 100 symptoms of perimenopause and menopause. So I want you to remember that roller coaster analogy. If you have unusual symptoms, especially if you're in your 40s, you should see your doctor, because there's a good chance you could be experiencing perimenopausal symptoms, which there is help for. So let's put all of this into perspective with a little timeline. At just 5 months old in the womb, a female fetus already has about 7 million eggs in her ovaries. Yeah, 7 million. That's a lot of eggs. But by the time she's born, that number has already dropped down to around 1 to 2 million. If we fast forward to puberty, when the periods begin and ovulation starts, she's down to about 300 to 500,000 eggs in the ovaries. And we don't actually release all of those eggs. Some of them are released during ovulation each month with the menstrual cycle. but some of them are going to just dissolve or die off over time. Throughout the reproductive years, that egg supply continues to decline. So by the time we reach menopause, the number of eggs that remain can drop down dramatically, down to maybe 300 or 400. And most of those are no longer viable eggs. So like I mentioned before, most people don't realize this, but menopause is just that one day. It's not an event, it's not a season, it's the exact day that you've gone a full 12 months without a menstrual period. But again, you don't know that you're in menopause until you've looked back and realized it's been a whole year. Because during perimenopause, you might go 6 months without a period, and then boom, bam, surprise, it shows up again. And that resets the clock. Resets that clock again. A lot of people don't like to hear that, but it is the case. So until you've gone a full year with no period, you're still in perimenopause. And once you've passed that 12-month mark, you're officially postmenopausal. Can you reverse perimenopause? A lot of people think that that's the case because they might one day be having symptoms and then the next day they're symptom free, or the next month, for example, they're symptom free. I've had lots of patients that had hot flashes, they're having hot flashes, and then suddenly their hot flashes have gone away. And that may be related to, again, that roller coaster. The hormones go up, you're feeling good. They come down, you feel like crap. They go up, you feel good again. They come down, you feel like crap again. So we can see that the symptoms may vary throughout the course of perimenopause. So you can't exactly reverse it, but you can manage the symptoms and feel better than you do when you're in the throes of those symptoms. So hot flashes, fatigue, vaginal dryness, and libido issues, they all have science-backed solutions. Some of those solutions include hormone therapy, and that's a good option. I use that with my patients. There are also some really good non-hormonal options. Lifestyle shifts with coaching and mind-body tools like hypnosis can make some really powerful shifts. And this is at the core of the work I do as a gynecologist, coach, and hypnotherapist for women over 40. So you don't have to fall into what I call the superwoman syndrome and just try to power through. There is actual help that's researched back and that actually works. So don't suffer in silence. Get some help. Can menopause start early? Yes, it can. Natural menopause typically happens between 40 and 58. It's a big wide range, but for most people, menopause happens around 50, 51, somewhere in there, 52 sometimes. We see that. But about 3% of women experience early menopause before the age of 45. And about 1% have primary ovarian insufficiency, which can occur prior to age 40. So if your period stopped prior to 40, that's pretty early for that to happen. So you do want to talk to your doctor about that for sure. And again, postmenopause is as soon as you hit that 12-month mark with no period, you're technically postmenopausal. Those estrogen levels drop very low, and that can continue with a host of symptoms. So that can linger, those symptoms can linger for a long time when we're talking about things like the vaginal dryness, low libido. But again, there's help. It's not too late to reclaim your pleasure and confidence when you're postmenopausal. So just reach out and get some help for that. So some final thoughts here. Perimenopause can really feel like we're unraveling, but you're not unraveling. I like to think of it as evolving. And this is a really powerful transition. And when you understand what's happening in your body, what's going on underneath the surface, behind the scenes, you can get your power back. If this hits home for you, don't just suffer in silence, please. Get some help, reach out to me. There's a community that is available to support you through this transition. I've created the Change Wellness series, which is a free wellness webinar workshop series designed for professional women over 40 who are navigating perimenopause and menopause. What is your most confusing perimenopausal symptom? I want you to drop that in the comments for me, and let's talk about it. If you're ready to shift out of survival mode, understand what's happening in your body, and build a nourishing, holistic self-care practice that fits your lifestyle, check out the link below and you can join me in this webinar series. If you found anything that I discussed here today valuable, please go ahead and hit that subscribe button, and I will see you soon.